When the brain ages, even if you can live a long time, you can't travel, you become depressed every day, or you forget about important people. There are not a few people who can't enjoy their envisioned life in old age because they develop cognitive disorders. On the other hand, there are many people who are still healthy and active even after they turn 80. What could be the difference? It's not surprising that being alone has about the same risk as smoking, isn't it? We will also explain about dietary methods and drinks that may reduce the risk of brain aging, so please watch until the end. Thank you for watching the video. Even if you can live long when your brain ages, you may not be able to eat your favorite things. You may not be able to travel, or you may become reclusive every day. You may even forget about important people. Even if I am actually a doctor and have an outpatient clinic, after retirement, I have spent my whole life and spent money, but I was diagnosed with cognitive disease at such a timing, and I was imagining. There are not many people who can't enjoy their life in old age. It is said that it is the era of 100 years of life. But in fact, even if you can live up to 100 years, most of the last decade of your life will be in a state where someone's care is necessary. On the other hand, even if you are over 80 years old, you can use a smartphone and even go on overseas trips. There are many such powerful patients who are over 80 years old. When you exceed 80 years old, the aging of various organs, including the brain, begins. On the other hand, even if you are over 80 years old, you are energetic, in a good mood, and healthy. There are many people who are living energetically in a good mood and healthy even after they are over 80 years old. What is the difference? This time, from the perspective of a doctor who is actually treating elderly people in their 70s and 80s, we will introduce the characteristics of people who do not age their brains even after they are over 80 years old and are always in a good mood. That's what we're going to talk about today. First, we'll discuss the latest insights on brain aging. Next, we'll cover the 5 traits of people with brains that don't age. Finally, we'll focus on early signs of cognitive impairment, a precursor to dementia that people should know about. With that said, let's explain. There is a possibility to reduce the risk of brain aging. We'll cover dietary methods and drinks, so stay tuned. At YouTube Medical University, we share practical medical info from the perspective of practicing doctors. Subscribe so you don't miss our latest videos. I'm happy. Let's get started. Let's talk about brain aging. What does it mean when the brain ages? The typical example is dementia. It's a problem for everyone. It is said that 1 in several people over the age of 80 will develop dementia. Is it actually said that 1 in 5 people? And believe it or not, it is said that 1 in 2 people will develop dementia when they reach their 90s. Becoming demented? I understand the reason, and it's the most common among dementia. Alzheimer's, the most common form of dementia, is caused by the accumulation of amyloid plaques in the brain. Surprisingly, this waste product, Alzheimer's disease, this waste also accumulates in people without Alzheimer's as they age. From this, the following hypothesis can be considered. Brain aging is a gradual accumulation of waste even before becoming a cognitive disorder. It's possible that this process continues due to this. In fact, it has been observed. In cases where the brains of the elderly have been dissected, this amyloid plaque, a type of plaque, is found in most of their brains. There is data that this plaque accumulates regardless of whether or not there is cognitive impairment. What is the difference between people who accumulate this aging waste and those who do not? And how can we live to reduce the risk and keep our brains from aging even into our 80s and live energetically? That's the question. In part 2, we'll cover dietary and sleep habits linked to cognitive impairment risk. We will introduce 5 latest data on this, especially the last one is something unexpected that has not been mentioned much in other videos, so please look forward to it. But before that, let's review the first part. Cognitive impairment is a representative of brain aging. And then, in the 80s, 1 in 5 people, and in the 90s, 1 in 2 people develop cognitive impairment. It's that kind of era. Even in the elderly who do not have Alzheimer's disease, there are many people who have amyloid beta, an aging waste product, accumulated in their brains. If this aging waste accumulates, the brain ages and eventually develops cognitive impairment. We introduce such a thing. So in the second part, I will introduce the characteristics of people whose brains do not age while sharing my own experiences. On the internet and television, there are not a few things that are advertised as having reduced the risk of cognitive impairment so much by conducting various studies and having some effect on cognitive impairment. Behind such news, they are emphasizing because they want to sell their own products. There are such things as well. First of all, it is often said to be effective for cognitive impairment, but in fact the effect is not confirmed much. While introducing such things, I will introduce 5 characteristics of people whose brains do not age in the second half. So, first of all, these are the things that are advertised as improving cognitive impairment but have little effect. Whether it's vitamins or beta-carotene, they're said to be good for the brain. Docosahexaenoic acid, eicosapentaenoic acid. There is no solid data to suggest that these substances improve cognitive disorders. It's not necessarily wrong because there's no data. Some people may actually feel the effects after taking them, but I think there are individual differences and it's not necessarily something you have to take, so please be aware. If you're concerned, discuss with your primary care doctor whether to take it or not. I think it's best to decide whether to take it or not in consultation with your doctor, and at the very bottom it says cognitive disorder medication. Is there no effect of cognitive disorder medication? For those who thought so, actually the cognitive disorder medication currently on sale in Japan has been proven to have some effect. However, the effect obtained with the medication is just a slight improvement in the score of the cognitive disorder test, even if the family is actually dealing with it. It is said that there is no improvement to the extent that you can tell that cognitive function has improved all at once. Rather, after starting cognitive disorder medication, there are more cases where people suffer from side effects such as loss of appetite and vomiting. I have actually prescribed cognitive disorder medication, but if it doesn't work, rather, side effects may occur, so I'm considering stopping it. Remember the medication. Now let's move on to what everyone's been waiting for. I will introduce 5 lifestyle habits that may reduce the risk of cognitive disorders, which are characteristics of people whose brains do not age. 5 characteristics of people whose brains do not age. The first one is drinking coffee. It is said that there is a connection between coffee and cognitive disorders, which can be mistaken for a disease that causes a decline in motivation. There is a study that followed 50,000 women for 10 years. Out of these 50,000 people, about 2,607 people developed depression. When looking at the dietary content of people who developed depression and those who did not, it's quite something. Compared to people who drink less than 1 cup a week or do not drink coffee at all, people who drink 2 to 3 cups of caffeinated coffee a day have a lower incidence of depression. There is such data. By the way, it was said that there was no difference in things like decaffeinated coffee, caffeinated tea, or the amount of chocolate intake. So it is understood that drinking 2 to 3 cups of caffeinated coffee a day may reduce the incidence of depression. In fact, what is called depression is referred to as a mood disorder in the medical world. If you develop depression, you may lose the will to do anything and stop going out of the house. Your appetite and muscle strength decrease, causing your body to weaken and become susceptible to illness. To prevent brain aging and possibly reduce the incidence of depression, why not consider consuming coffee? 5 characteristics of people whose brains do not age. The second one is the Mediterranean diet. Have you all heard of the Mediterranean diet? The Mediterranean diet is a dietary habit that is often preferred and eaten around the Mediterranean in Europe. To put it simply, it involves eating a lot of fruits and vegetables, consuming more fish than dairy products or meat, and combining these with olive oil, nuts, whole grains, and legumes. It's also famous under the name Mediterranean diet. There is data from a high credibility test called a randomized controlled trial related to the Mediterranean diet, where teams were divided into those who ate the Mediterranean diet and those who ate a diet with reduced oil. This involved randomly selecting people aged 55 to 80. People are divided into those who eat the Mediterranean diet and those who eat a diet with less oil. About 7,000 people participated, but those who ate the Mediterranean diet had less oil. Studies show that people who ate the Mediterranean diet had better cognitive scores compared to those who ate a diet with less oil. Just by eating the Mediterranean diet, cognitive scores improve. We introduced such data that there is a possibility. One point to note is that this experiment is after all. This is a test that compared whether the incidence of myocardial infarction and cerebral infarction would decrease, so if we look back later to the utmost, the cognitive score was better for those who were eating a Mediterranean diet, and it was only later that we found out, so it's solid. The data is inconclusive, but the results are promising regarding the Mediterranean diets. It reduced the incidence of myocardial infarction and cerebral infarction. That was the result. What is called cognitive disorder is actually a cerebrovascular cognitive disorder, and it can occur due to arteriosclerosis of the brain vessels, so please be aware. The Mediterranean diet, which can prevent diseases caused by arteriosclerosis such as myocardial infarction and cerebral infarction, is worth trying. I think it's worth a try. 5 characteristics of people whose brains do not age. The third one is this: exercise. Exercise is a no-brainer, isn't it? High blood pressure, cholesterol, and diabetes. Arteriosclerosis progresses, and ultimately it becomes a risk for myocardial infarction and cerebral infarction, but it has been proven that exercise can reduce these risks. But not only that, it may also reduce the risk of cognitive disorders, such in various observational studies on the risk of cognitive disorders and exercise. The opposite correlation has been proven. It seems that if you exercise, the risk of cognitive disorders decreases. It's about dividing a certain group into those who exercise and those who don't, and comparing the incidence of cognitive disorders among these people. If you do that, those who did not exercise compared to those who did, the risk of cognitive disorders is high, we understand that. However, there is a point to note. This is because the risk of cognitive disorders has not decreased, but rather, for instance, regular exercisers tend to be more educated, which may reduce their risk of cognitive disorders. Alternatively, it could be that exercisers socialize more with various people, and this communication is the reason that they were reducing the risk of cognitive disorders, including various influences. Exercise may reduce the risk of cognitive disorders, but it has not been definitively proven. However, exercise can help prevent conditions like myocardial infarction and cerebral infarction. There is solid data that reduces the risk of life-threatening diseases, so exercise has various risks are also reduced, and if possible, it may also reduce the risk of cognitive diseases. So let's try it even once a week, or try changing the elevator you always use to stairs, such things. Improving your lifestyle habits little by little may increase the possibility of your brain staying healthy without aging, so please consider it. 5 characteristics of people whose brains do not age. The fourth is this: people who have connections with others. This is also based on my personal experience as a foreigner, but there are many people who have various relationships with others, such as volunteering or traveling with family, even in their 80s and living a lively life. Teacher, this day is it okay to postpone it for a week because there is a town meeting and I can't go to the clinic? There are also people who are so busy coming to the clinic. In fact, it is understood that being socially isolated, not having connections, carries about the same risk as smoking 15 cigarettes. Being alone carries about the same risk as smoking. Isn't that surprising? There are also other diseases such as cognitive disorders. There is data suggesting it can even increase the mortality rate. We introduced the third exercise, but there are experiments comparing which is better for the body's health, doing this exercise or having connections with people. There are people who go to the exercise circle but actually do not exercise. People who do not go to the exercise circle but exercise hard alone. In the future, among these two groups who will need care, in other words, who cannot do without someone's help. Who will become unable to live without becoming dependent? Who will become less likely to become so? Which group do you think it is? The answer is surprisingly people who go to the exercise circle but are not actually exercising and are just chatting with others. It seems that those who exercise alone are more likely to strengthen their bodies and less likely to need care. But in fact, those who go to the exercise circle and enjoy the company of others, even though they are not exercising, were less likely to need care. How surprising is that? The connection with people is not always visible to the eye, and it's hard to understand the connection with health, but when shown with data, there is a difference like this. Finally, let's look at the 5 characteristics of people whose brains do not age. The 5th one is here. These are people who know they have a treatable cognitive disorder. I've been forgetting things a lot lately. And worry I might have dementia. To avoid being found out, I've started avoiding people and going out less, which has led to decreased exercise and social connections. I don't want to justify my behavior by admitting my memory issues. The risk of dementia increases as you go out less and less. However, there are various causes for dementia, and among them, there are types of dementia that can be treated. Here is a list of treatable dementias. When you hear the word dementia, you might think of Alzheimer's disease, but there are various causes. Transient dementia, as introduced earlier, is a condition caused by a certain disease where you lose the will to do anything and even the ability to think. It's a condition that can be mistaken for dementia. And secondly, there is what is called drug-induced. For example, there are substances in cold medicine that can induce sleepiness. In addition to that, some sleep medications can increase the risk of dementia, and in reality, there are cases where the level of consciousness is lowered and it is mistaken for dementia. And then there's the thyroid, an organ in the throat which regulates the metabolism of the body. It produces hormones. If the function of this thyroid gland decreases, you may lose the will to do anything, your metabolism may slow down, and you may become unable to move. And you may develop cognitive disorders among other things. Other causes could be a lack of vitamins, or sexually transmitted diseases like syphilis. And then, subarachnoid hemorrhage, a type of brain hemorrhage, can also cause symptoms of cognitive disorders. These are caused by cognitive disorders. Once cognitive disorders have developed, they can no longer be cured. Some cognitive disorders are treatable. If you suspect you have one, seek medical examination and appropriate treatment at a hospital to improve your condition. Don't assume it's incurable and leave it untreated. I have experienced many of them. It's heartbreaking. I've seen many cases where people have lost appetite and weight, coming to the clinic dressed as if for bed. One was a man in his 70s. However, once diagnosed with hypothyroidism and treated, he was unrecognizable months later. Even his clothes were bright and crisp. His expression at the clinic was very impressive. Remember, there are treatable cognitive disorders. That said, such things exist within limits. People with these symptoms may be one step away from cognitive disorders. I will introduce 6 symptoms that may be early signs of cognitive disorders, and on the contrary, you might be wondering if you have a cognitive disorder just because you often forget personal items. This type of forgetfulness is not a cognitive disorder. Anyone can experience it. However, it may require attention. I will explain the difference between ordinary forgetfulness and forgetfulness related to cognitive disorders. This review discusses 5 traits of individuals whose brains remain youthful into their 80s, focusing on the second limit. With that said, the first point is to drink 2 to 3 cups of coffee with caffeine per day. This can reduce the risk of heart disease. We have introduced such a thing. The second point is what is called a Mediterranean diet. It can also reduce the risk of myocardial infarction and cerebral infarction. We have introduced data that improve the scores of cognitive disorders. The third point is that there is a correlation that the risk of cognitive disorders is reduced in people who exercise. The fourth was surprising. Maintaining relationships lowers the risk of cognitive disorders. It is possible, and being alone is a taboo. I introduced the risks of cognitive disorders, which are equivalent to smoking 15 cigarettes. When you forget something, go to the hospital for a diagnosis and correct examination, as some cognitive disorders are curable. That's important. I've introduced such things, then unexpectedly and unknowingly reached the third limit at the end. I will introduce 6 early symptoms of cognitive disorders. Dementia is a disease that gradually progresses. If left untreated, it will progress gradually, reducing what can be done and making it impossible to leave the house. Losing the ability to exercise and interact can accelerate the decline in cognitive function, leading to irreversible incidents. To prevent this, it's important to catch the early symptoms of cognitive disorders and take measures as soon as possible. As I mentioned earlier, the early symptoms of dementia are not just forgetfulness, but also the ability to perceive space in 3 dimensions. I'd like to briefly discuss screening methods for cognitive disorders, as these abilities may decline over time. Here are 6 early symptoms of dementia to consider if you've experienced them: forgetting things, difficulty relating to yourself and others. Pay attention to these potential warning signs. The first one is repeating the same thing over and over again, or asking the same question. For example, forgetting that your daughter who lives with you has gone to work and calling her many times to ask, "What were you doing today?" Or, "No, I told you that your mother went to work." It's common to make phone calls many times a day. Secondly, you often forget where you put things and end up searching for them. This is because people with dementia often lose their recent memories, such as where they put things. So they often say things like, "Where did I put my wallet?" or "Where did I put my passbook?" And then people with dementia often feel that they must not lose their own sense of self and they must not cause trouble for others. So when they lose something, they might think, "I must not lose this, so I'll put it here where I won't forget." Or, "This is important, so I'll hide it somewhere only I know, so it won't be taken." Sometimes they hide things in unusual places, and when they do, they often can't find them again. They can't remember where they put it, and they might think, I think I'm fine, but I can't find my wallet. Why don't I have my wallet? My daughter, who always takes care of me, might have taken it without me knowing. The person themselves might get upset or they might blame their daughter. That's about it. Delusions of theft are a common symptom of dementia. When this happens, avoid responding with anger or denial as it may upset them. Instead, try to react calmly. Where did it go, right? Well, I want to look for it too, so can we look for it together? It's very important to take an attitude of cooperating with each other, to look for things so that you don't end up pointing fingers at each other, and if possible, when you find the item, it's best to let the person themselves find it. If a family member or someone else finds it first, they might be suspected of having taken it, so it's best to say, let's look for it together, and let the person find it. From a slightly higher perspective, like, did mom put it there? Taking care of them in this way is actually very important. The third early symptom is when previously simple tasks like cooking and shopping become challenging. Specific signs include a decrease in the variety of dishes prepared or an increase in simpler meals. This has been observed frequently as an early indicator. Like eating, or like recently, I've been buying food all the time. Saying you can't cook anymore could indicate an inability to prepare complex meals and may be the fourth early sign of cognitive issues. This is why your wallet becomes thin. I wonder why this is. Those who thought that might be here, the reason why your wallet is full of coins is because accounting becomes difficult. When you buy things at a convenience store or supermarket, when it's 635 yen in coins, how do you pay 635 yen in coins? Or what is 635 yen? It becomes like that. When that happens, people with cognitive disorders say that they have memories of the past, so they don't know how to pay 635 yen now, but they know how to pay 1,000 yen. They recall that paying with paper money streamlines accounting, so they attempt to pay with as much cash as possible and receive many coins as change. As a result, your wallet may fill up with coins. This is also an early symptom of cognitive disorders. Fifth, there may be a lack of motivation, causing you to stop hobbies and activities. People with cognitive disorders often become anxious because something feels strange to them. I wonder if I have dementia. But if I realize that I have dementia, it will cause confusion to those around me, so I won't say this. I am doing fine. I want to be like my mother. There are many people who have such thoughts, and if they cause confusion to those around them, they may stop this activity or their participation in society or hobbies may decrease. The most important thing to note is pseudo-dementia, which looks like dementia, but is actually a depression. Therefore, if you lose your motivation and your social participation decreases, it could be a symptom of dementia or it could be an early symptom of depression, and both possibilities actually exist. So, such symptoms are certainly early symptoms of dementia, but please remember that there could be dementia that needs attention or other diseases. And the sixth point. You may become irritable or suspicious. This is the base for those with dementia. I have anxiety about whether I should be serious or what I have done. There is such anxiety. In response to that, your family or if the social environment is not well adapted, social participation may decrease, the frequency of conversations with family may decrease, and stress may accumulate due to such things. It's hard to go as you think sometimes. I can't sort out my feelings well. When that happens, it's not unreasonable to think that the number of disputes will increase. When such disputes increase, it may be a sign that you're actually worried about your memory or something. Please remember everyone, as it may not be noticed. Do you know the difference between cognitive impairment and forgetfulness? Everyone understands normal forgetfulness. The so-called normal forgetfulness that anyone has is often like this. It's like, what was dinner last night? The forgetfulness of cognitive impairment often manifests as symptoms like, did I eat breakfast today? The difference is that forgetfulness is when you can't recall something, one of the three processes of memory. Normal forgetfulness means you can properly remember and retain information. However, you can't retrieve that retained memory, like, didn't I drink miso soup yesterday? When you're told, didn't you put the mushrooms you bought at the supermarket in? You can recall, oh yeah, I bought mushrooms at the supermarket, or oh yeah, I drank miso soup. For those with cognitive impairment, the first memory process, the act of remembering, is impaired. Even if asked, you drank miso soup, didn't you? You can't recall, so you might say, I didn't drink it. The memory itself appears to have vanished entirely. Being able to recall information when prompted is different from dementia symptoms. With dementia, you won't remember even if told. In case I end up not eating breakfast, this could indicate the possibility of dementia. There's no need to unnecessarily correct them at this point. Telling someone who doesn't remember eating that they ate is futile, like water off a duck's back. Instead, respond with something like, oh, is that so? What the other person is thinking, accepting their feelings and the reality of the situation is important, even if it leads to a dispute. When that happens, naturally change the topic of conversation or say something like, "I'm hungry now," and shift the focus. Or suggest eating something considering the other person's perspective. It's very important to approach them in this way. I've made a comparison chart of dementia and normal forgetfulness for reference. I think it's easier to understand this way, so please take a screenshot or make a note of it for yourself. In terms of memory, with dementia, everything completely slips away. This results from a disruption in memory recall stages. Normal forgetfulness is when a part of the memory is easily lost, like forgetting yesterday's snack. Can't remember, something like that. Symptoms like these are common in normal forgetfulness. As for the function of recall, in the case of cognitive disorders, memory is fundamentally impaired, so you can't recall. However, if we change the subject, you can remember events that happened decades ago. Why is that? It's because those things were already remembered before the cognitive disorder occurred, so you can recall past events, but new memories are not being formed, so you can't recall them in the first place. But in the case of normal forgetfulness, you're able to remember, it's just that you can't recall. If you're told, you can recall. So, it's a matter of whether you're aware of it or not. The first question I get is about personal forgetfulness, and I say I'm fine, but the root of that is cognitive disorders. Those with cognitive disorders have lost their memory, so more people are unaware of it. They say, that's strange, right? After all, people with cognitive disorders have no memory, so for them, they might not have eaten breakfast. So it takes a while for them to realize that something is wrong with them or that they are strange. But in the case of general forgetfulness, you can realize that you've forgotten something like, oh, I can't remember that, so you can recall what you've forgotten. It's a matter of being able to realize that. You might feel like, I forgot, and get upset, so I'm worried about personal forgetfulness. Regarding the question of I'm worried about personal forgetfulness, those of us who think that way are, I'm considering whether it's not just a general forgetfulness. It depends on how it progresses. Cognitive disorders, as they're called, progress little by little over the course of a year. Over a span of about 2 years, I wonder if the cognitive disorder hasn't progressed a little. Something that can be objectively seen becomes a cognitive disorder, but why is that? General forgetfulness, such as frequently forgetting things, is concerning. Many people report forgetting things for the past 5 years, indicating a difference. The most common type is general cognitive disorder, but here's a brief supplement on the topic. We're talking about a cognitive disorder called Alzheimer's type dementia. Other types of dementia include Lewy body dementia, vascular dementia, and what is called Pick's disease. There are various types of dementia, but here we focus on Alzheimer's, the most common form of dementia. We are discussing Alzheimer's disease, a form of dementia. However, was it okay? I think you may not understand what cognitive disorder is. Let's review it in 3 parts. As early symptoms of cognitive disorder, repeating the same thing over and over, asking the same thing, increasing forgetfulness of where things are placed, often looking for things, taking more time for cooking and shopping that used to be able to do, wallet becoming bulky with small change, losing interest and reducing hobbies or extracurricular activities, becoming suspicious or easily angry. I introduced these. The difference between normal forgetfulness and cognitive disorder is that with normal forgetfulness, only part of a memory is missing and can be recalled when reminded. In contrast, cognitive disorders cause specific memories to be completely lost and irretrievable, even when reminded. I introduced the difference. The things I introduced in this video are to reduce the risk of cognitive disorder. These are some potential risk reduction measures. However, implementing them doesn't guarantee reduced risk. Reduce the risk of cognitive disorders such as certain lifestyle habits and dietary habits. Research is still ongoing, however, things like exercise, a Mediterranean diet, and the like are known to reduce the risk of not only cognitive disorders, but also high blood pressure, diabetes, and other arteriosclerosis that can lead to heart attacks and other life-threatening diseases. Even if you're in your 80s, to live a healthy life without aging your brain, please try at least one of these things that could potentially reduce the risk of cognitive disorders. At YouTube Medical University, we are broadcasting knowledge that is useful for health, which can be used from tomorrow, while showing data from the standpoint of active doctors. It's my motivation, so don't miss tomorrow's video and press the channel registration button. I would be happy if you could. Those who are watching this video I think there are many people who have a high health consciousness or have a family member with cognitive impairment. On YouTube, both medical professionals and non-medical professionals are broadcasting various information. There are not a few things that can cause misunderstandings. It's an era where information is overflowing, so it's very important to have a reliable source of information. On YouTube Medical University, the videos may be a bit long and difficult. It may be a bit difficult, but why do these symptoms occur and how can they be prevented? I hope to introduce knowledge that can be a weapon for everyone to think about their own health. So if you like it, let's study together at YouTube Medical University. And in the comment section, if you have any experiences like I became healthy by having such a diet, or I had a hard time with such an experience, please let me know regarding this video. Whether you like this video or not, your feedback will help improve future content. See you in the next video.